I'm a BACP accredited counsellor and psychotherapist, and I also do supervision. And I run a private counselling practice called New Focus Therapy. I also have an MA in focusing and experiential psychotherapy, and I'm recognised as a focusing oriented therapist and trainer. I think that the good thing about focusing oriented therapy is that it's research based, and in particular it's based on research done originally within person-centred counselling as to why some clients succeed in therapy when others don't. And the research goes back to originally goes back to a couple of guys called Kirtner and Cartwright, who were part of Carl Rogers' research team. Basically what Kirtner and Cartwright, Gendelin and others discovered was that the successful clients had something called a deeper experiencing level, and also that you could facilitate that deeper experiencing levels in clients who didn't naturally know what to do. So there's a strong correlation between experiencing levels and successful outcomes in therapy. And by successful outcome, what I mean is that over the course of the therapy, clients began to feel better about themselves and began to make constructive changes to their lives. One of the things that I think you're going to get out of the workshop is this ability to spot how clients are using therapy, and in particular to spot what I call clients' experiencing levels. It'll also help you to spot successful clients and not get in their way, and it will give you some tools to invite clients to deepen their experiencing level and improve their outcomes in therapy. We're going to be looking briefly at the person-centred roots of focusing-oriented therapy. We're going to be having a look at a definition of FOT. We're going to be looking at spotting clients' experiencing levels, and we're also going to be looking at how to facilitate higher experiencing levels using a combination of reflective listening and deepening proposals, also known as focusing invitations. And then at the end of it, we're going to have a little look at sort of integration into your practice, and also further training and resources. I've taught this workshop before and I've really enjoyed it, and the things that make it enjoyable for me is sort of passing on knowledge to other therapists. It's also about seeing therapists, sometimes quite sceptical, actually try some of the exercises, and that scepticism can change. But it's also about knowing that those therapists have some really useful basic tools to take in their therapy practice and to help clients achieve better outcomes in therapy.